Thanks very much for staying with us. Time now for African News with me, Georgia Calvin-Smith. Tonight, Algerian soldiers spend the day combing through eastern mountains in search of the French hostage held by a militant group that's threatened to execute their captive. France doesn't stop airstrikes on jihadists in Iraq. Paris says, though, it will not negotiate. Also, worrying projections on Ebola suggest that almost 1.5 million people could be infected by next year. This, though, is tempered by insistence that a surge in aid could roll back the epidemic. And boo-boos are big business. We take a look at the Czech company that took a gamble on the West African fashion staple a decade ago is now reaping the rewards. First up, Algerian troops have been racing against the clock, hunting through the mountains in the east for a Frenchman taken hostage by Islamist militants. Hervé Pierre Gordel's captors yesterday threatened to kill him within 24 hours if France didn't pull out of airstrikes on fighters of the Islamic State group in Iraq. Well, an IS splinter cell, calling itself the Soldiers of the Caliphate, has claimed responsibility for Gordel's abduction.
The group is known as the Caliphate Soldiers of Algeria. It's threatening to execute French hostage Hervé Gordel if France doesn't halt airstrikes in Iraq.
It was only a matter of time before France was targeted by a terrorist attack. In this case, it was a kidnapping, but it could have been something else, given how determined this group is.
The Caliphate Soldiers of Algeria is a splinter group of al-Qaeda in the Islamic Maghreb. It officially broke away from the North African cell in July and swore loyalty to the even more radical al-Qaeda breakaway group, the Islamic State Organization. On September 14th, Khaled Abu Salman, a former military al-Qaeda commander, claimed leadership of the new group and gave it its name. In a statement, he said he was leaving al-Qaeda because it had deviated from its true path. According to analysts, many other splinter groups could soon follow the same path and join the Islamic State Organization.
The Islamic State has managed to recruit many militants in Syria, Iraq, and beyond these borders. On top of that, it's marked the minds of militants with very violent executions of the 2 Americans and a British journalist, and it's now very probable that other groups will do the same.
The Caliphate Soldiers of Algeria is the first al-Qaeda group to side with the Islamic State Organization. Its latest successes in gaining territory in Iraq and Syria appeals to younger militants compared to al-Qaeda and its aging leader, Ayman al-Zawahiri.
Well, up to 1.4 million people in West Africa could be infected with Ebola by next January, warned the US's Center for Disease Control and Prevention. Now, they suspect the current figure of almost 6,000 sufferers is suffering from significant underreporting. On a more hopeful note, the CDC believes a surge in international relief efforts could massively roll back Ebola's spread. The number of Liberian cases doubles every few weeks, and in Sierra Leone, about every month. There, 130 new cases and 92 bodies were uncovered during a 3-day nationwide shutdown over the weekend. Well, Dr Ian Norton heads up foreign medical teams for the WHO, and he joins us now from Sierra Leone. Doctor, thanks for speaking to us. Now, international aid has recently been picking up more steam, but it's still nowhere near enough. When you consider that 154 disaster teams responded to the destruction wrought by the typhoon in the Philippines last year, and only 4 to West Africa, what's it going to take to get more willing hands in play?
Well, we're looking to build lots of Ebola treatment centres for these teams to walk into and start treatment within. So many teams have claimed that they don't have experience in Ebola, which is right. MSF have always carried the heavy burden in Ebola response up till now. And now they're overstretched and they're asking for more help. The WHO is asking for more help. And so one of the key things that were stopping that response was the lack of the beds, the lack of the facilities that teams could come inside and work within.
So from what you're seeing, is there enough of the right kinds of help being offered?
Help has been slow in coming. We're asking the foreign medical teams from governments, from large NGOs, to step forward and take over these Ebola treatment units. You'll see a total of 24 being built in Liberia over the next number of weeks. We'll see many more being built here to add to that total. at least another 7 over here in Sierra Leone, where I am now. But that's just the start. Building the facilities is one part. Running them with good infection control is the key, and assisting national staff who will also work within them. But we really need internationals to come in and help support, run the logistics, run the hygiene and the control, so we can avoid any further healthcare worker infections.
Now, health systems of countries at the centre of this epidemic were weak before the outbreak. They're now being overwhelmed. Is there a risk that they might never recover?
It's certainly a risk that something with such an impact on a fragile but developing health system could have long-lasting implications. We really worry about access to immunizations for children, access to safe deliveries for women who are labouring, access to malaria medication and typhoid. It's the wet season here. And as I've stopped on the side of the road after visiting multiple hospitals during today to the north of the country near Kenema and Bo, and many of them were empty. Many of them are with the patients who would normally be within these hospitals are at home trying to be cared for by their relatives, even if they have basic things like malaria and typhoid, because they're afraid to come into the facilities for fear of Ebola within them.
Thanks very much. Dr Ian Norton there speaking to us from Sierra Leone. Well, as Dr Norton mentioned, there's suspicion of the processes put in place to try and roll back Ebola and of the aid workers themselves amongst affected communities as one of the biggest hindrances to the containment of the disease. Now, the mistrust has seen many volunteers attacked and even killed by those they're trying to help. Our correspondent headed to rural Guinea, where several people from an Ebola awareness team were killed by villagers last week.
This is the WHO car that was attacked last week in Guinea. 8 health workers were killed. They were raising awareness about Ebola. 7 months after the virus was first officially reported in Guinea, some villagers still believe health teams spread the virus. But this psychologist says the situation is gradually improving.
Things are changing. People are starting to understand what's going on. At least here in Guékédou, most villagers understand what MSF is doing.
To gain the people's trust, every morning Maurice from MSF and his colleagues go and speak to residents and tell them how to fight Ebola. So far, there have been no cases in this district.
I went to see a family and I deliberately didn't wash my hands. The father noticed and told me to wash them, and that was a good exercise.
The local chief says all the recommendations are respected.
All day long, we wash our hands before we go out and when we come back home.
But the death toll continues to rise.
This morning the patient was sitting here outside, and now he's there, dead, on the bed.
The World Health Organization says the death toll in West Africa, which is currently at nearly 3,000, could reach 20,000 in November.
Now, lawyers defending 4 men charged in connection to Kenya's Westgate Mall massacre a year ago say that their clients have been assaulted whilst being held in jail. Proceedings were adjourned after the suspect appeared in court with bandaged limbs on Tuesday. They claim to have been attacked by prison guards. While the country's Human Rights Commission is looking into the allegations, the defendants are accused of helping the gunman from the Al-Shabaab militant group who attacked the Nairobi Mall. 67 people were killed. Today, the wife of one of the accused said that she was sorry the fatal incident ever happened.
To the Westgate victims, I'm saying sorry. You know, I'm also Kenyan, but I don't want my rights to be trampled upon, just like I don't want the rights of any Kenyan to be violated. Those who got wounded there, those who are in trouble, to them I say sorry, but we've done nothing wrong.
Well, finally, the annual pilgrimage to Mecca is due at the start of October, and producers of the traditional West African bubu are gearing up for a rush. One of the biggest names in the business took a gamble on the fashion staple a decade ago and is now seeing big returns. Take a look.
Bromov, a small Czech town that's home to the firm Weber. Not exactly where you'd expect to find African-type mannequins. But Weber produces high-quality brocade in demand from Mauritania to Cameroon through Mali and Senegal. Markets where Weber has gradually gained share.
90% of our output is exported and is related to the Muslim calendar. Our products are worn by pilgrims from Africa, and we hope to also get into Arabic countries.
At first, Weber's bankers, insurers and suppliers shook their heads in disbelief.
Even though there is huge poverty in Africa, there is also growth and more rich consumers who like our products. But like everywhere, there are risks. For example, we've so far been unable to get credit insurance on contracts with African partners.
Millions of meters of brocade are produced here every year using cotton from Egypt and India on machines from Germany and France. The unlikely global business has enabled Weber to save jobs in a region where the textile industry has suffered from Asian competition since borders opened.
Under communism, we were essentially producing domestic textiles that were exported to the USSR. We had to modernize all our machines and also to learn how to do business with African people, to learn their cultural and religious traditions.
Weber's main competitors are from Germany and Austria, but the Czech company is already a major player, providing Mecca-bound pilgrims with white cotton and brocade that'll be dyed and sewn to make bubu worn in Bamako or Dakar.
Well, that wraps up African news from me. Stay with us for a short break and more news and headlines from around the world coming up.